It's Friday, everyone. What do we do on Fridays here at the Hint Hive? That's right, we smash the patriarchy. Hey there, beautiful humans. Welcome back to the Hint Hive, Amplifying Women's Voices. I'm your host, Kelly Hint, aka Queen Bee of this particular hive, as well as your resident feminist life coach and psychotherapist. This is the place where we talk about the stuff women are told not to talk about. And we do it loudly, unapologetically, and with a whole lot of truth. Here in the Hive, we challenge systems that silence women. We unpack the psychology behind the nonsense that society throws at us. And we remind women that their voices, their bodies, and their lived experiences matter. Today's episode is one that I feel in my bones, quite literally, both as a psychotherapist and as a woman living in a busted up body that exists in a society that doesn't always believe us. We are talking about how society gaslights women about pain and illness. And if you've ever been told it's probably just stress, or you're overreacting, your labs look normal, you're just anxious, you're probably just tired, and my favorite, maybe you should try yoga. While your body is screaming that something is wrong, this episode is absolutely for you. Because here's the truth that patriarchy does not want us to say out loud. Women are not being dramatic. Women are being dismissed. Today, we are going to dig deep into this topic. We'll talk about the psychology of medical gaslighting, the research showing how women's pain is dismissed, why this is happening in our healthcare system, the historical roots of these attitudes towards women, the psychological impact of not being believed, and most importantly, how women can advocate for themselves without losing their damn minds. Because knowledge is power. And when women understand the system, we are much better equipped to navigate it. So grab your tea, take a deep breath, settle in, and let's get into it. For those who have been listening to the audio version of this podcast for a while, you may remember me discussing medical gaslighting in past episodes. So no, you are not going crazy. I have discussed this before. But it's an important topic and one worth covering from more angles. And on a personal note, for those watching the video version of this podcast today, you may be observing right now that I kind of look like crap, or maybe you're just very polite and not even thinking that, so thank you. But to be honest with you, I feel like crap. I have been trying to record this damn episode for 2 weeks, and my physical health has not been cooperating. So instead of trying to plaster on a bunch of makeup and pretend that everything is just great, you are getting the raw, unapologetic version of me today. No gaslighting happening here. Welcome to the world of chronic illness. So let's start with the basics. Medical gaslighting happens when healthcare professionals dismiss, minimize, or misattribute a patient's symptoms, causing the patient to question their own experience of pain or illness. Now, here's the important nuance here. Gaslighting in medicine does not always happen intentionally. Most doctors are not sitting in exam rooms twirling their mustaches like cartoon villains thinking, how can I invalidate this woman today? No, they're not doing that. But that doesn't mean that the impact isn't harmful. Because when a woman repeatedly hears things like, your tests are normal, it's probably anxiety, you're just hormonal, maybe you're stressed, try losing some weight. The underlying message becomes your experience cannot be trusted. And over time, hearing that message again and again begins to erode a woman's confidence in her own body. This is what gaslighting does. It slowly disconnects people from their internal reality. And when that happens in a medical setting where people are supposed to feel safe seeking help, the damage can be profound and affect many areas of life. Let's talk about the data for a minute, because this isn't just anecdotal frustration. Trust me on this. Research across multiple medical disciplines has repeatedly shown that women experience systemic bias in healthcare. For example, studies have found that women experiencing heart attacks are more likely to be misdiagnosed in emergency departments compared to men. Part of the reason is that heart attack symptoms in women often look different than the classic symptoms that were historically studied in male patients. Women may experience nausea, fatigue, jaw pain, back pain, and shortness of breath, instead of the dramatic chest-clutching symptom pattern that we often see portrayed in movies. Because medical education historically centered male bodies, women's symptoms were sometimes treated as atypical, even though they're actually incredibly common among women. Research has also shown that women are less likely to receive adequate pain medication in emergency departments. In fact, multiple studies have found that women presenting with pain are more likely to receive sedatives instead of analgesics, which is a fancy term for pain relievers. So think about that for a moment. Instead of treating the pain, the system sometimes treats the emotion about the pain. Here, have a benzo instead of pain relief. That, my friends, is a powerful example of gender bias. I can't remember if I shared this story before, so apologies if you've already heard this one, but there was a time when my husband, who has veins as big as an earthworm, mind you, was given a numbing cream before they inserted his IV. A freaking numbing cream. But me, I get bruised from fingertip to elbow on both arms as they stab me all over trying to get an IV started, with absolutely no offer to numb me up. Now, this is clearly not the most serious of medical issues, I get it. But it just made me laugh at how my husband gets babied at the same exact hospital where I've shot a couple of 8-pounders out of my uterus with no pain medication, let alone gotten a numbing cream for an IV. Clearly, I have some bitterness there. And thankfully, I do not live in that area anymore, and I do get fantastic medical care now. Anyway, let's go back to talking about women with chronic illnesses. So, with women having chronic illnesses like endometriosis, autoimmune disorders, fibromyalgia, and chronic fatigue syndrome, these women often wait years, sometimes decades, for diagnosis. I've shared before that it took over 15 years for me to get diagnosed with lupus. The average time, for example, to diagnose endometriosis is estimated to be approximately 7 to 10 years. 7 to 10 years of pain. 7 to 10 years of appointments. 7 to 10 years of women wondering if they are losing their minds. This isn't just a medical issue. That's a cultural issue. To understand why this happens, we have to zoom out and look at history. For centuries, women's health was filtered through a deeply patriarchal medical system. In the 1800s, women were frequently diagnosed with something called hysteria, a catch-all label used when doctors didn't understand women's symptoms. Women experiencing grief, trauma, chronic pain, sexual dissatisfaction, or emotional distress could all be labeled as hysterical. The word hysteria comes from the Greek word hystera, meaning uterus. Yes, women's distress was literally attributed to their reproductive organs. WTF, right? This belief system led to all kinds of disturbing treatments, including forced institutionalization, so-called rest cures, where women were isolated from their lives and confined to bed for weeks or months, and other interventions that stripped women of autonomy over their own bodies and decisions. In many cases, women who expressed anger, grief, chronic pain, or resistance to restrictive gender roles were labeled mentally unstable and removed from their homes. Physicians and family members often had legal authority to commit women to institutions, meaning a husband or male relative could effectively silence a woman by declaring her hysterical. These practices reinforced the idea that women's suffering was not something to investigate medically, but something to control socially. And we wonder why the world is filled with some angry feminists, right? Now, while the word hysteria isn't used in modern medicine the way it once was, the cultural echoes of that belief system are still very much alive. Today, it shows up when women are told, "You're just anxious." Maybe you're just overwhelmed. Maybe you're overthinking it. Those phrases may sound modern, but psychologically, they're carrying the same message. The problem must be in the woman's mind. There's a deep psychological toll of not being believed. When a woman repeatedly seeks help and gets dismissed, something profound happens psychologically. She begins to doubt herself. This can lead to self-doubt, medical trauma, delayed treatment, shame about seeking care, feeling dramatic or difficult, and anxiety about future medical appointments. Not to mention how that self-doubt about her own body leads to a total lack of trust in herself and her own intuition. In therapy, I hear versions of this story all the time. Women say things like, "Maybe it really is just me. Maybe I'm exaggerating. Maybe I'm being dramatic." And that sentence breaks my heart every single time. Because when society gaslights women about their bodies, it does not just impact their physical health. It fractures their relationship with themselves. They stop trusting their instincts. They stop seeking care. They push through pain that deserves attention. And sometimes that delay leads to serious medical consequences. Let's talk about a few conditions where this pattern shows up again and again. First up, we've got endometriosis. This is a condition where tissue similar to the uterine lining grows outside the uterus. It can cause severe pelvic pain, infertility, inflammation, and organ complications. Yet, countless women are told that their symptoms are simply bad periods. If you're one of these women, I am so sorry that this happened to you. Some women are told to take ibuprofen and come back if things get worse. Meanwhile, the disease continues progressing. Next up, autoimmune diseases. Nearly 80% of autoimmune disease patients are women. Interesting fact, huh? Especially given the lack of attention given to most autoimmune issues. It's almost as if diseases affecting primarily women aren't a priority in medical research. Can we say, hello, patriarchy? These autoimmune diseases include conditions like lupus, rheumatoid arthritis, Hashimoto's disease, and multiple sclerosis, among many others. And because symptoms can fluctuate, fatigue one week, joint pain the next, brain fog another day, patients are sometimes labeled as anxious or psychosomatic before a diagnosis is made. I have seen firsthand as a therapist how damaging it can be for a legitimate issue to be labeled psychosomatic. I have worked with countless women who have experienced this, and I get angry on their behalf every single time. Because I see over and over just how damaging it is when a woman with a legitimate medical condition is told that it's all in her head. Next up, we've got fibromyalgia. This condition causes widespread pain, fatigue, and cognitive difficulties, often called fibrofog. For years, it was dismissed as a psychological condition or something that women were imagining. Today, we know that fibromyalgia involves measurable neurological pain processing differences. Unfortunately, there are still many women being misdiagnosed with fibromyalgia as a catch-all diagnosis instead of further investigation, which can lead to serious complications. For example, I've known women with the fibromyalgia label slapped on them when they have had lupus, and undiagnosed lupus can lead to undiagnosed kidney issues, which can be serious and lead to death. All right, finally, we've got chronic fatigue syndrome. Now called, let me see if I can pronounce this correctly, myalgic encephalomyelitis, or ME/CFS, for those of us who can't pronounce it correctly. This condition can be profoundly disabling. People with ME/CFS may struggle with extreme exhaustion, cognitive impairment, and post-exertional crashes. Yet, many patients report being told they simply need to exercise more, sleep better, or reduce stress. Some of these recommendations can actually worsen symptoms. So why does this continue to happen in modern healthcare? Well, several structural issues play a role. First, we've got gender bias in medicine. Historically, medical research was conducted primarily on male bodies. Clinical trials often excluded women due to concerns about hormonal fluctuations or pregnancy risk. The result? Diagnostic criteria in treatment guidelines were built largely around male physiology. Women were prescribed medications that were never even tested on a female body. Next, we have time pressures in healthcare. Many physicians today are working under intense system pressure. Appointments may be only 10 to 15 minutes long. Complex symptoms that require deeper investigation can easily get pushed aside in favor of quicker explanations. And listen, as someone who works in the healthcare field, I get it. Insurance nonsense and corporate profit are prioritized over patient care. It can be overwhelming and incredibly exhausting to be a healthcare provider. I have so much empathy for providers working in these types of environments. But I also expect quality healthcare. I feel that because I have operated within these restrictive systems, other providers need to figure out how to do the same or advocate for better working conditions. And I need to add that all of my current providers are fantastic women who excel at what they do despite the systems that they are dealing with. Kudos to my badass female medical team. And finally, we still have gendered cultural stereotypes. Women are often socially labeled as emotional, dramatic, and overly sensitive. These stereotypes can overtly or even subtly influence clinical judgment, even among well-meaning professionals. Implicit bias is powerful, and it often operates outside conscious awareness. Now, let's talk about empowerment, because that's what we do here in the Hive. While the system absolutely needs reform, there are also ways that women can strengthen their own advocacy inside the system. Let's talk action steps. Step number 1, document your symptoms. Keep a symptom journal, including timing, severity, triggers, sleep patterns, menstrual cycle patterns, and physical changes. Patterns can help clinicians see the bigger picture. And documentation can be incredibly helpful if you end up seeing multiple providers. And for those like me, whose mind often goes completely blank when I get into my provider's office, it can help to keep everything ready, concise, and organized. Step number 2, bring someone with you. Having a partner, friend, or family member present can sometimes shift the dynamic in medical appointments. It shouldn't matter, but unfortunately, it often does. A second person can also help remember information and ask additional questions. And for one of the women that I work with, she is treated differently when she brings a male to her appointments with her. And yes, she gave me permission to share that. So, bring someone with you if you can. All right, step number 3, ask direct questions. Direct communication can change the tone of an appointment. Questions like, what else could be causing these symptoms? Or, what tests would rule out more serious conditions? If this continues, what is the next step in evaluation? And one of the most powerful questions that you can ask: can you document in my chart that I requested further evaluation? Boom, queen, right there. That question often encourages providers to reconsider dismissing symptoms too quickly. Step number 4, seek second opinions. Ladies, you are not obligated to stay with a provider who dismisses you. Medicine is a collaborative relationship, and sometimes finding the right provider makes an enormous difference in getting answers. I'm telling you, it literally changed my life once I had a proper medical team. I walked away from a very sought-after specialist due to his arrogance, condescension, and gaslighting. And let me tell you, I have never regretted it. All right, finally, step number 5, trust your body. Your body is not lying to you. Even when the medical system struggles to identify the cause of your symptoms, your experience still deserves validation and investigation. You deserve providers who take your concerns seriously. All right, my gal pals. Here in the Hive, we always end with an affirmation, because mindset matters when you're navigating systems that were not built for you. Our affirmation of the week is this: my pain is real, my body is wise, and I deserve to be heard, believed, and cared for. Say that again with me, because this is important. My pain is real. My body is wise, and I deserve to be heard, believed, and cared for. This affirmation matters because gaslighting works by making you question your reality. But affirmations rebuild that inner trust. I know it sounds a little hokey and woo-woo, but trust me, affirmations do work. They reconnect you with your intuition. They remind you that your lived experience carries authority, even when external systems try to invalidate it. Every single time a woman chooses to trust her body instead of dismissing it, she is reclaiming power. And that is a deeply radical feminist act. Okay, ladies, if this episode resonated with you, I want you to hear this clearly. You are not weak for seeking help. You are not dramatic for wanting answers. You are not too sensitive for advocating for your health. You are a human being living in a body that deserves care, attention, and respect. And every time a woman refuses to be silenced about her pain, she chips away at a system that has ignored women for far too long. And that ripple effect matters, because when women speak up, other women start recognizing their own experiences. And when enough voices come together, systems eventually have to change. That is how progress happens. And ladies, I'm also going to say this. If you're having a hard time in this area, reach out to me. Let's do the work together. I just had an amazing session with one of my badass queens, and she said that everybody should have a coach. And I will add /therapist. Because coaching or therapy or a combination of both can get you to feeling like the true badass that you are. And let me tell you, I would be honored if you chose me to work with you. And, as always, if you found this episode helpful, share it with another woman who needs to hear it. Send it to the friend who has been dismissed by doctors. Send it to the sister who keeps being told it's just stress. Send it to the woman who has started doubting her own body. Because information is power. And when women start comparing notes, systems start changing. And if you're not already a part of our community, come join us in the Hint Hive Facebook group, where women support women and these conversations can continue beyond the podcast. And of course, don't forget to like, subscribe, leave a review, and share the show, because those small actions can help amplify women's voices. Because those small actions help amplify women's voices and get these conversations into more ears. You are helping me to spread the message of equality for all. So thank you for those of you who continue to support the show and share it. Until next time, my queens, keep questioning, keep advocating, and keep amplifying women's voices. This podcast is powered by Kelly Hint Empowerment Coaching, as well as Kelly M. Hint LMHC and The Cranky Counselor. To find out more about coaching services, head over to CoachKellyHint.com. If you'd like to know more about the psychotherapy services I offer to individuals within the state of New York, you can check out KellyMHint.com. And if you'd like to learn more about aromatherapy, you can check out TheCrankyCounselor.com.